Welcome back, Sunbro. We hope you all in great health and great money. Today we are going to talk about look out for early dementia and causes of memory loss in your 30s. More often than not, dementia is a condition that affects the elderly. In actuality, those who are younger are not exempt from the disease's threat. Early dementia or early-onset dementia are terms used to describe young-onset dementia. It can be brought on by a variety of brain conditions, from Alzheimer's to excessive alcohol use, that impair cognitive function. Early dementia, what is it? A collection of illnesses and cognitive impairments known as dementia can quickly deteriorate mental function. This illness can impact a person's ability to remember things, communicate, make decisions, and handle social settings. Most patients with dementia are 65 years of age or older. A kind of dementia known as early dementia or early-onset dementia affects people under the age of 65. Early dementia can be identified in patients as young as 50, 40, or even 30. Early dementia essentially shares traits with other forms of dementia. Early dementia, however, may have a greater effect on the owner's life because, often at that age, a person is still actively working full-time, starting a family, or serving as the support system. Early dementia causes. Early-onset dementia can have slightly different origins than dementia in elderly people. Early dementia has a number of common causes, including 1. Alzheimer's disease. The difference between dementia and Alzheimer's disease is still often difficult to make out. The most typical cause of early dementia is Alzheimer's disease. Plaque accumulation in the brain leads to Alzheimer's disease. The plaque can then impair brain function, particularly memory function, and lead to the death of brain cells. Memory loss is typically the first sign of Alzheimer's disease in older persons. However, memory loss is less likely to be an early sign of Alzheimer's in younger people. 2. Unusual Alzheimer's illness. Atypical, unusual, Alzheimer's is the kind of the illness that most frequently affects young individuals and produces early dementia. Depending on the exact form of the disease, atypical Alzheimer's symptoms can include the following. In most cases, a difficulty processing visual information, such as difficulties reading or judging distance, is the initial sign of posterior cerebral atrophy, PCA. Typically, language difficulties, such as having trouble finding the correct words or speaking with extended pauses, are the first sign of logopenic aphasia. The early signs of behavioral Alzheimer's disease, which typically include acting inappropriately in social situations and having trouble planning and making decisions. 3. Alzheimer's illness in families. It is an extremely uncommon illness brought on by inherited or genetic abnormalities. There are frequently multiple more family members with early-onset dementia who are the same age as the individual who has familial Alzheimer's in addition to themselves. Typically, the earlier symptoms develop, the more likely the disease is inherited. 4. Learning problems. People with Down syndrome and learning disabilities are also more likely to develop early dementia. This is assumed to be the case because the extra copy of chromosome 21 that most Down syndrome sufferers possess can promote the development of plaque in the brain and result in Alzheimer's. 5. Vascular dementia. An issue with the blood flow to the brain results in vascular dementia. Diabetes and cardiovascular conditions including heart disease and stroke are directly tied to it. Early memory loss is uncommon in vascular dementia, but there are other symptoms that are more typical, one of which is a decreased thinking speed. 6. Cadacil. Cadacil is yet another trigger for early dementia, cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy. A rare form of vascular dementia known as cadacil has genetic roots. When a person is in their mid-30s, this cerebrovascular disease may start to show symptoms. Migraines, repeated strokes, seizures, apathy, and depression are all signs of cadacil. 7. Frontotemporal dementia. When the front and/or side lobes of the brain are damaged, frontotemporal dementia, or FTD, can develop. The condition is regarded as one of the causes of early-onset dementia since it affects persons between the ages of 45 and 65 more frequently than older people do. 8. Lewy body dementia. Lewy body dementia, DLB, is a type of dementia brought on by the accumulation of small protein deposits in the brain known as Lewy bodies. Parkinson's disease can also be brought on by Lewy bodies, and 1 in 3 sufferers eventually develop dementia. 9. Brain damage brought on by alcohol. Over a long period of time, excessive alcohol consumption can directly harm the brain and nerve cells. This behavior raises the risk of Wernicke-Korsakoff syndrome and early alcohol-related dementia. Early dementia brought on by alcohol typically affects persons in their 40s and 50s, and it is more prevalent in men. Early signs of dementia. Early-stage dementia symptoms are remarkably similar to those of advanced dementia. Some symptoms that could manifest are memory loss that affects day-to-day functioning, difficulty carrying out routine duties, loss of the capacity to reason clearly or to make decisions, planning or problem-solving challenges, confusion about the time or location, difficulty comprehending spatial relationships and visual pictures, reduced or poor judgment, repetitive behaviors, changes in the personality and emotions, withdrawing from friends, family, and work, word and language issues whether speaking or writing, items gone missing and no way to go back and retrace your steps. Early stages of dementia can affect a person's quality of life, so as soon as symptoms start to develop, you should see a doctor to begin treatment. Thanks for watching Sun Bro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting Sun Bro.